Welcome to BioBalance Healthcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb, and today we're going to be talking about a topic that affects a lot of women who are postmenopausal who have had vaginal deliveries in their lifetime. And it's a problem that most of them encounter. They don't seem to talk to a lot of people about it. They don't necessarily know to anticipate that it's going to be a problem. And when it happens, they feel embarrassed, they may feel ashamed, and they are concerned. What's wrong with me? There are lots of possible interpretations about, well, why is this happening? So today we want to talk about it. We want to talk about what the interpretations of that are and what you can do about it. And the problem is incontinence in women over 40 who have had vaginal births.
Right.
So,
that's right. And incontinence can happen at any age.
Right.
For various reasons, but we're limiting what we're going to talk about today to women who have vaginal births or who have carried large babies, because that also affects the supporting structures. Large babies or twins and not had a vaginal birth does the same thing to the bladder. But there are two kinds of incontinence. One is the incontinence that is most likely to happen to women, and that is stress incontinence. And then the other kind is irritable bladder, where the bladder spasms, and every time it spasms, you lose urine.
Okay, so incontinence really means a urine leakage as opposed to not being able to urinate.
That's true.
Okay.
That's true.
So there are unexpected urine leakage concerns that these women begin to have.
Well, we feel like babies. And we don't want to wear diapers.
Right.
I mean,
yeah.
That's ridiculous. Women will talk to each other
about
it
depends.
Bleeding, babies, all kinds of stuff. But they won't. I'm ignoring you. But they won't talk about urine loss, because that means that's like what Grandma did and had to wear diapers.
Well, I think that's why Grandma wears so much perfume. I mean, you go to some of these places and you can't breathe because all these women have this conflicting perfume aroma.
They can't smell either. They lose their sense of smell.
I know that sense is gone, but I also think they're covering up.
And they very well maybe.
Yeah.
But our babies smell good because we have good diapers now. So I assume we have good diapers for adults.
Yes.
But we don't have. I'm trying to talk to you about how not to have to wear diapers.
Exactly.
How not to have to change your life because of this. Because if you have incontinence of any kind, you're also going to have incontinence when you have sex. Now, that is something that's going to stop you from having sex.
Yeah.
So the last thing women want is to, I feel so sexy, and then to lose urine during sex, and then they're mortified.
Right.
They're not going to have sex again. Yeah. Or they're not for a long time until they absolutely have to, because it's an embarrassing thing.
And if they don't know, then they assume something is really wrong.
And it's very hard to tell your doctor that you're losing urine. However, your doctors know if you've had a vaginal birth or more than one vaginal birth, they know very well that when you have a vaginal birth that your bladder is not going to work later. Because in general, that's what happens. That's kind of one of those things. It's kind of like they don't talk to you about your breast sagging after breastfeeding. We know that.
Right.
But why tell them something that's going to make them not breastfeed?
If it ain't broke, don't fix it.
That's right.
Yeah.
But I mean, one of the risks of having a vaginal birth is incontinence. So actually, we should be informed of that while we're pregnant. Now my soapbox is down. I'll put it away.
All right.
And but stress urinary incontinence has to do with that particular incontinence has to do with the tearing out or stretching of all the supporting structures in the pelvis, because women have round pelvises to have babies, okay?
Right.
Most women have a round pelvis. Men have flat pelvises.
Okay.
So because you have a round pelvis, it's as big as a baby's head on the inside, then you have a lot of area that has to be supported. Your bladder is part of what's being supported. Your uterus my uterus is part of what's being supported. And it has muscles and tendons, and it's like a hammock, and it's holding everything up. So that's what we need intact to keep our bladder continent. Now, this type of bladder incontinence has to do with the angle of the urethra, and women have a very short urethra. Okay, men don't have incontinence for this reason.
And the urethra is the
tube that you can see the opening of right above the vagina. Okay, so You can see that little opening, but it's only about that long at the very most. And you have to have an angle with the bladder. So the bladder's here and the urethra is here. The bladder usually sits kind of on top. And your uterus is right underneath this. And so when your bladder fills up, it gets big like this. And when you urinate, you straighten that angle. So then it all comes out. And that's a neurologic function. Yes, you need your nerves for that.
So you need to have a kink in your urethra to be what you want
to be continent.
Yes.
You have to have that angle. So that is what we lose when the baby's sitting on your bladder, and then when you push the baby out, the bladder starts coming out with the baby, and it tears out the supporting structures.
Because you're pushing all of that?
You're pushing a watermelon out through your vagina.
Yeah.
And so it tears all those little muscle fibers and the connective tissue. So that is what happens. It's a weakness.
So the more babies you have vaginally, then the more guaranteed it is that you're going to have this problem.
Right, and a lot of people have it after one baby, and then they have another, and then it gets worse, and then they have another, and doctors don't, or surgeons, urologists don't want to fix it if you're going to have more babies because you're going to tear it out.
Well, and so what happens is when they cough or when they sneeze or when they laugh, they squirt a little bit of urine out.
Or if they lift something. You could just
pick up
lift your child.
Yeah.
Lean down, lift your child, pick it up, especially if you squat to pick up, which is good for your back.
Right.
You squat, you open up the pelvis more and loosen up those muscles, and the bladder falls and you pee.
Okay.
It's a horrible thing to have happen to a young woman. Now, what mostly happens is you get better after each baby, and you don't have a constant problem with incontinence. You have just intermittent, it doesn't change your life, you can put up with it. You know if you have a cold, that you're gonna have to wear a pad or something, because you're gonna cough and lose urine. Now, most of my patients ask me, well, why did I have just little bits of incontinence, and then I turned 40, and now I have incontinence all the time.
Right.
And then those that didn't get it all the time after 40 get it after menopause. Okay. And so those reasons with stress incontinence have to do with the damaged tissue that you are able to still tolerate and still keep you continent. Everything gets thinner when the testosterone leaves after you're 40. So all of those tissues, the muscles, the connective tissue, the fascia, and the tendons all stretch out and get lax. The bladder falls more, and then you're incontinent more often, excuse me. But then when estrogen leaves, it gets worse. When estrogen leaves, estrogen is, the bladder's an estrogen sensitive organ. So when you lose estrogen, the opening to the vagina gets very thin. Vagina and urethra gets very thin. And so the bladder itself loses integrity.
So the cell walls get thinner because they're stretched or elongated?
The tissue of the bladder itself, not the cells, but the cells may get farther apart. But the tissue itself that makes up the bladder actually gets lax.
Okay.
And gets thin. The tissue get maybe this thick, and I mean microscopically, we're multiplying the microscopic image, but if the wall's that thick before menopause and then it becomes very, very thin, then the whole bladder loses integrity and you lose the angle all the time.
So women are just doomed to have this happen, or is there something they can do about it?
No, they're not doomed. It's terrible to talk about a problem that you don't have an answer for.
Yeah.
So there are multiple things that you can do. I mean, obviously we've talked about surgery.
C-sections.
Yeah, you can have a C-section instead of vaginal birth. Then you can have surgery.
Don't have fat babies.
Yeah. When our mothers had this, they smoked, so they all had little babies.
Yeah.
So we don't smoke anymore, and we don't do anything bad, so our babies are really big. So in general, and in any case, you don't want, that's preventive. But then afterwards, you can go to a urologist and you can have the surgery where they pull up the area around the neck of the bladder. And so it pulls it up and makes that angle so that you can urinate.
Kind of like a facelift. You just have a bladder lift.
Yeah, it is. So that's That's one thing you can do. But before you do that, I think it's wise to get your hormones checked because that's non-invasive. You can get a blood test and see if you have any estrogen, if you have any testosterone, and if you're low on those. Most of my patients come to me for other reasons, and then they go, oh, and by the way, I don't have incontinence anymore. And that's because all their muscles around and underneath the bladder are thicker and tighter. Okay?
Yes.
Then the estrogen that I give them makes the lining thicker. So in the bladder itself, so the bladder has more integrity, and that little opening that's your urethra, it thickens up so that it's not so easy to let urine out.
So that's the estrogen. Is the testosterone involved in that as well?
Testosterone does the muscle part.
Okay.
The testosterone holds up the bladder better and the uterus by making better muscles in that sling that we were talking
the estrogen
about.
affects the gland or the organ.
Yes.
And the testosterone affects the muscles, but
around it.
Complementary benefit of restoring the strength so that you don't have the incontinence problem.
Yes, and some people will still, it's so damaged, or they start out with such thin connective tissue that this is something that they still have to have surgery for, but your surgery then works better, okay? Because it's going to heal better, and you have the basis of what you needed to begin with to have a continent bladder.
So you've been talking about incontinence in the bladder, and you started by saying there are two different kinds. One is stress-induced, and the other is
stress is
an
like
irritable
lifting
bladder.
or coughing.
Right.
And the other is irritable bladder, but we're going to have to talk about that next time.
Okay.
But the stress incontinence is the most common, and the thing I see the most. And I fix the most. And you also have to remember not to get the lowest dose of estrogen because that doesn't work. Lowest is not best in the world of bladders. You have to have enough estrogen to actually be like a 35-year-old so that your bladder thinks you're a 35-year-old.
Right.
So normal levels like 60 to 250 is a normal level of estrogen. That's what you should have, and then you'll heal.
So 60 to 250 is still a wide range.
Well, that's because we cycle, you know, and so we go between 60 and 250.
So you stay in that range.
If you stay in the range, most women are better when they are between 90 and 115. That's adequate. But those low dose hormone replacement therapies, those bring you up to about 10 or 30.
So do you recommend the different methodologies? I mean, is it cream or a pellet or a pill? I mean,
well, I recommend you can get a high enough dose of oral if you take oral.
Right.
You can bring it up to a higher dose, and that will get you the right level. But you can also get the right dose with a patch. You just have to have a high enough dose patch. And doctors are always trying to get you to the lower dose. We don't do that with any medicine. Oh yeah, you have diabetes. Let me give you the lowest level of insulin I can possibly give you. Your blood sugar will still be high, but that's okay. We're just going to give you a low dose. We don't do that with anything but
you'll just go into a
hormones.
small coma.
Right. You know, and you're just going to have all kinds of neurologic deficits because we just gave you a little insulin. We don't do that with anything but hormones. I think it's ridiculous.
Yeah.
Because, of course, then again, we're women. They don't do that with men's hormones. They give men enough hormone to be 35 again. And so, once again, we hit that impasse of doctors are trained to give the least amount of drug to women, and then they're trained, because most of them are men still, to give them adequate doses.
So we have enough information here that we need to do an additional podcast on this, and hopefully you're interested and you want to know more about what works for you and what your situation might be. And if we haven't touched on it yet in this conversation, please watch for the next podcast. If you have specific questions that you want to ask us or comments that you'd like to share with us, you can always contact us.
You can contact me at biobalancehealth.com, that's the website, or podcast at biobalancehealth.com, or you can call my office at 314-993-0963.
And you can always reach me at brettnewcomb.com.